and welcome to Time with Lydia, the pharmacist. Today I want to share some simple tips on how you can treat hay fever. Hay fever has become increasingly common, and in the UK, for example, 1 out of every 4 people suffer from hay fever. Hay fever is allergy to pollen, that is pollen from trees, from grass, or mould pollen. Pollen is a fine powder that is released from plants. When the weather is warm, that is when most plants release pollen, and that is when most people suffer from hay fever symptoms. The symptoms of hay fever would normally include sneezing, coughing, blocked nose, itchy throat, itchy nose and ears, a loss of smell. Sometimes too you can experience a headache, an earache, tiredness, and postnasal drip. Hay fever symptoms can make you feel so tired and sometimes prevent you from falling asleep. It can be very irritating, and when the symptoms become severe, then you know that it's time to treat it. With the treatment of hay fever, normally all the symptoms need treated. If you have itchy eyes, you would need an eye drop. If you have itchy nose, you would need a nasal spray, and with the general symptoms, you would need some tablets. So when you go into a pharmacy and you need treatment for hay fever, most of the time you would get 3 different things. You would get an eye drop, you will get a steroid nasal spray, and you will get hay fever tablet or antihistamine tablets. And you would have to use all these products in order to get rid of the symptoms. So now let's go straight into the treatment of hay fever. When you visit the community pharmacy, your pharmacist will give you antihistamine tablets. Antihistamine tablets block the effect of histamine that causes the symptoms of hay fever. So they tend to reduce the symptoms of hay fever. It is always advisable that you take antihistamine tablets before you get into contact with pollen. So once you take your antihistamine tablets, there's a likelihood that you will not suffer any symptoms at all, and the effect of the pollen on your body will be very little. Antihistamine tablets generally tend to improve symptoms such as runny nose and sneezing. There are different types of antihistamine tablets. We have the sedating ones and the non-sedating ones. There is no scientific evidence to indicate that one group of antihistamines are better than the other. They both work well, and most of the time it boils down to patient preference. Examples of sedating antihistamines are promethazine and chlorpheniramine. These antihistamines can make you drowsy even up to the next day, but they are very useful when hay fever symptoms are preventing you from falling asleep during the night. Because of the sedating effect, they would help you sleep better. The non-sedating ones include loratadine, cetirizine, and fexofenadine, and these are the most preferred, especially for people who do manual work and drive. The second treatment option from your community pharmacy are steroid nasal sprays, and these are good at improving nasal symptoms such as nasal congestion and sneezing. They are very effective when you start using them 2 to 3 weeks before the hay fever season. Examples include beclomethasone and fluticasone. But bear in mind that steroid nasal sprays can only be used by people who are above the age of 18 years. Now, if you have itchy and runny eyes, you would need an eye drop, and an example of an eye drop that you can purchase from your local community pharmacy is sodium cromoglycate. This is very effective at reducing the symptoms of itchy and runny eyes. Now, as I said earlier, when it comes to hay fever, all symptoms need treated. So you would realize that you would end up with the tablets, the eye drops, and the nasal spray. And it is advisable that you use them all as prescribed so you gain the maximum benefit. If after using these pharmacy products, your symptoms do not improve, then it's advisable that you visit your doctor for further checks. I hope this video is helpful. Please don't go without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of my informative content. Subscription is free. Do leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next one. Bye for now.